Hello, this is Dr. Jason Acevedo, and I'm here today to speak with you about open implantation of hypoglossal nerve stimulator, or more commonly known as the Inspire procedure. And this is a procedure that's done for patients with sleep apnea that can't tolerate a CPAP machine, which is a pretty significant number of the population. About 35 to 40% of patients will struggle with CPAP. And for those patients, the hypoglossal nerve stimulator is a great way to treat their sleep apnea. So what that entails, to be a candidate for the hypoglossal nerve stimulator or Inspire procedure, there are some pretty strict requirements from insurance. One of which is that your body mass index has to be 35 or less, which it's a number that deals with your weight and height, but there's some simple online calculators you can plug that into and figure out where you're at. Number two, you have to have moderate to severe sleep apnea, so typically greater than 15 pauses per hour, and for some insurances, no more than 65 per hour. And then the third qualification is that you would have to have a test done by me called a drug-induced sleep endoscopy, where we give you a light sedation either at the surgery center or in the office, and I use a flexible camera to go down your nose, examine the back of your throat, and make sure that the collapse pattern of your throat is favorable to have a hypoglossal nerve stimulator. Typically for patients that their throat collapses top to bottom, they do very well. For patients that have what's called circumferential collapse, where it's almost like a valve, they tend to not do as well. So to be a candidate for the Inspire, you do have to have that top to bottom, or what they call anterior posterior collapse. But if you meet those three criteria, you would potentially be a candidate for the hypoglossal nerve stimulator. And the way that surgery is done, it is done at the surgery center or the hospital with general anesthesia. Typically, you would be asleep, you would not feel or remember anything. And all I would do is, once you're asleep, 2 incisions. The first, right about here on the right-hand side, just below the jawbone. Second incision lower down on the chest. The first incision allows me to put a small electrode on the nerve that goes to the back of your throat that controls the opening and closing of your throat. Then there's a small wire that's tunneled down. It connects with the chest implant, which looks very similar to a pacemaker, about the size of a saltine cracker. And that's where the battery and the computer are stored. Then there's some stitches that go in. We wake you up. Procedure takes typically less than an hour, a little bit of time in recovery, and then head on home. And then recovery stitches come out about a week after surgery. And we wait about a month for healing, and then we activate the device, which is done in the office. We turn it on. We send you home with a remote that helps control it. There's an app that goes on your phone that will record the data and upload it to the internet to make sure that we know it's working appropriately for you. But then when you go to bed at night, you just put the remote over the device on your chest, push the button, activate it, and then your sleep apnea is being treated. And we've been very, very happy in our experience. We've been seeing about a 95% success rate in successfully treating patients' sleep apnea with the Inspire device or hypoglossal nerve stimulator. Risks of the procedure, it's very safe, very well tolerated, but like any surgery, there are risks. Pain is one of them, so you will be sent home with a prescription for pain medication afterwards. Bleeding is possible but very rare. Infection also possible but very rare. We put IV antibiotics in during surgery, and afterwards you'd be on antibiotics post-operatively. Nerve damage is possible. There's the implant is put on the nerve that controls the muscles in your throat, so some temporary weakness of the tongue is possible. Also, the nerve that helps you smile and move your lips runs in that area, so sometimes there's some temporary weakness there. And then with any surgery, there's always the chance that it doesn't work. So, like I said, about 5% of patients, the device may not do what they want it to. But overall, for patients that are struggling with their CPAP, it is a great procedure. And if you'd like more information, you can reach out to my office, or if you've already been seen and are in the process, we can get you scheduled. All right. Have a great rest of your day.